State TV. My name is Wilder Fleming. I'm joined today by Yev Feyman, a fellow at the Manhattan Institute. Yev and his team have built a map showing the effects of the Affordable Care Act on individuals who do not get health insurance through their employers or through government programs like Medicaid and Medicare. Thanks for joining me, Yev.
Thanks for having me.
So nearly 1.2 million New Yorkers fall into this category, according to your map. What are the most significant findings about the effects of the ACA on these individuals in New York?
Well, so the people in New York are definitely seeing costs drop significantly. In the old individual market in New York, you would see prices well over $1,000 per month for typical HMO coverage. Now those prices have dropped significantly. We've seen drops of roughly about 45% statewide, with some counties seeing lower drops, other counties seeing much higher drops. And
what counties see the lower drops and which see the higher?
So generally downstate counties, urban counties, New York City in particular is seeing one of the highest drops. Some upstate counties, generally those kind of in the east, not quite in the west, not really far up near Canada, but counties kind of bunched up in the center. Albany, for one, is seeing much lower drops, and in a few cases there are slight increases too.
Okay, and I see that rates for this group in other states went up quite significantly, so why the difference?
So it has to do with provisions that we've enacted in our individual market. Back when the first Cuomo was governor, we enacted pure community rating, which means that every single person has to get charged the same rate for insurance, regardless of health status, age, gender, etc. And we also put in guaranteed issue, which means insurance companies couldn't deny you insurance for any reason. We did all of that without the individual mandate. So by 2013, 2012, what we really had was a tiny individual market. Almost no one was in there, and the people who were the oldest and the sickest.
In New York, the rates appear to stay flat across age groups, while in other states they're significantly higher. Yes. And why would that be? So
that has to do with the community rating provision. Obamacare, the ACA, it lets states move to a 3-to-1 band. It requires at most a 3-to-1 band, meaning 64-year-olds can only be charged 3 times what 21-year-olds are. But New York chose to keep their pure community rating from before, which is a 1-to-1 band. So all ages get charged the same, but it puts pressure on rates for younger people as a result.
Okay. And this is obviously good for this group of New Yorkers, maybe not so good for this group in other states. But what is the effect on the overall healthcare system?
So overall, the ACA hasn't had much of an effect on the healthcare system just yet. We've only seen the beginning of its full implementation. It certainly increased insurance costs in the individual market. We'll have to see what happens with the employer mandate. There may be wider-reaching effects on the economy, especially as different parts of the ACA get implemented. Accountable care organizations are going to be a big part of it. Whether the ACA can actually reduce healthcare spending, we'll have to wait and see. Probably 5-6 years down the line, we'll be able to start saying something more concrete.
Mm-hmm. And so is New York, do you think that is New York a leader in this? Sorry, this is a hard question, but is New York, did they really pave the way for doing this correctly? Do you have any?
In some ways. So New York really had nowhere to go but up. So in that sense, New York has been one of the biggest successes, but rates in New York are still among the most expensive in the country. You can get plans in Chicago, for instance, for about half the rate and get much better coverage than what you can here. So New York has a long way to go. The exchange website is far from perfect. You still can't window shop even. So there are a lot of changes New York is going to have to make, and New York is going to have to hold back on some of the regulations they want to implement, like limits on narrow networks, because it's those innovations like narrow networks that help keep rates lower than they otherwise would be.
What are narrow networks?
So it's just a way for insurance companies to help keep premiums down by telling people that you can only see these providers. So we're not going to cover these guys. We haven't negotiated rates with them, so we're not going to pay for you to go see them.
Okay. And is there a certain profile for these people? I see that the largest number of them were in their 20s or in their 50s.
Right. So there's no one general profile really. A lot of the people are going to be young kids fresh out of college. Some of them might be just over 26. They might be 27 because so they've lost their parents' insurance. They're no longer eligible for that. For the elderly or those near retirement, really, a lot of them are thinking about quitting their job. Maybe they can't because they're staying on for insurance. First-year enrollees especially are going to be lower income. A big chunk of first-year enrollment, roughly half, was in Medicaid. So that means their income is below 138% of the federal poverty line. The rest is largely below 250%, so probably under 28, 29,000 for a single person. In the coming years, we're going to see people with higher incomes go in and get less in federal subsidies.
Okay, Yev Feyman from the Manhattan Institute, thanks for joining me.
Thanks for having me.